Hello there, Healthcare Experience Matters listeners. I am super excited to introduce you all to Keith Darrow. He is our guest today on Healthcare Experience Matters, and he is a clinical audiologist, but he also has taken that a step further, and he goes on to study the brain and how it interacts with hearing. So I'm going to pause there and let him give his full background for us and just establish why he's so established in what we're going to talk about today. And that is kind of hearing, improved communication, and how all of that relates back to elevating patient experiences. So Keith, take it away. Tell us about what you do.
Thank you so much for having me here. Look, my journey started about 20 years ago, where basically I stumbled into the field of hearing healthcare. I stumbled into audiology, found myself being overly passionate about hearing loss, about helping people. Perhaps it wasn't a coincidence that at the time my grandmother was suffering with this, as so many of our parents and grandparents do. But what struck me as I was completing my clinical degree to become an audiologist was I was fascinated by the connections of hearing and the brain and how the two sort of worked together. But if I'm being honest, I didn't get enough opportunity during my clinical rotations, my clinical classwork to really dive into it. And so that's where I sort of hit pause on that track to becoming a clinician. And I sort of started over again. I enrolled in a program. It's a joint program at Harvard Medical School and MIT. And I have a PhD in neuroscience. And I spent over 10 years at the Massachusetts Eye and Ear Infirmary in their labs at Harvard Medical School studying how hearing affects the brain, how the brain affects the ears. And it was early on I realized that the entire brain is stimulated by sound. The entire brain is stimulated every time we hear something. We can't close our ears like we close our eyes. And so it makes sense what we've learned over the past decade or so, that hearing is intimately tied to our brain power.
Would you equate the listening to hearing conversation almost like reading versus reading comprehension? I mean, so you can actually, is it like you can see
I would
the
actually, you
text?
know what? I would take it back and I would say it's like, can you see something? Do you see letters or do you understand them? Right. So I often use this analogy in the classroom when I teach that, when I traveled to Greece, I don't know the Greek language at all. And I would see their signs, whether it be street signs or restaurant signs, I could see them, but I couldn't understand them. Those are two different things, right? Hearing versus understanding and listening are two different things.
Great. And this is, I mean, we're talking to Dr. Keith Darrow here, and he is clearly one of the foremost authorities on this subject as someone who's studied audiology and neurology. And is there any advice you would give if someone thinks, hey, I mean, this person, like, how do you pick up on clues that, if someone can hear you and they're not having hearing losses, but they're having listening issues? Is there any way to detect that?
I think it's so, you know, if I'm talking to medical clinicians, if I'm talking to primary care physicians, I'm begging you to stop doing the bedside hearing test, which is, rub your fingers next to a patient's ear. And if they say they can hear it, well, then move on, right? Yes, they might be able to hear it. I think it boils down to this basic question. Are you having difficulty following a conversation when there's background noise? So whether it be at a restaurant, whether it be at the holiday gathering at your house, whether it be, at the movies or anywhere where you're in a public setting, if you're having difficulty, and if you find yourself blaming, oh, it's too loud in here. Oh, it's the restaurant, it's not me. If you're in that phase where you're starting to doubt your listening ability, then take the first step. Have a thorough hearing evaluation. Find a certified provider in the Excellence in Audiology Network. They will look at hearing. They will look at listening. They will understand your risk, potential future risk for cognitive decline and dementia. And they will be able to thoroughly evaluate with pre and post-treatment test measures to make sure that you're being effectively treated.
And as we work towards wrapping up, now that I have you here, I'd be curious to know, like, what are the number one or most common ways people have hearing loss that they can control? And I'm just thinking, as a layperson here, maybe like a loud concert or a loud club music or something like that. But what are the most common ways people do lose hearing, and if there is any prevention, I'd love to hear about that.
Yeah, so let's talk about it. And when I talk about prevention with my patients, with my students, I talk about it in terms of primary and secondary prevention, right? So primary prevention, what do I mean by that? Yes, if you have the opportunity to prevent noise-induced hearing loss, you should do it. And I'm talking when you go to a concert, when you go to, sometimes movies are too loud now. Any situation, weddings, if any situation, it could be work, it could be mowing the lawn, any situation where if you wonder, is it too loud? The answer is always yes. And you should be protecting your hearing. And there's very easy, relatively cheap and affordable ways to do that, be it over the counter, custom made earplugs. There's all sorts of ways to prevent that. But, and here's the big but that comes with this, hearing loss as we get older is genetically built into us. It's part of our DNA. It's part of who we are as a mammal. Every mammal will experience age-related hearing loss as you get older. So there's no way to prevent that, right? So primary prevention, yes. If you can stay away from loud noises, do it. If you can protect your ears, do it. Now, in terms of secondary, if we acknowledge that hearing loss is a fact of life as we get older, well, now we have to prevent the secondary. We have to prevent the downstream impacts of untreated hearing loss. And by that, I mean, we know that untreated hearing loss, so if you ignore it, if you let it go, if you just say, oh, maybe next year, increases your risk of cognitive decline, increases your risk of dementia, increases your risk of a traumatic fall, being hospitalized, early retirement, like premature death. How about that? It doesn't get much worse than that. So untreated hearing loss is a very bad thing, and it's horrible for your physical, social, emotional, and cognitive health and financial health. Yet treatment is available and has been shown to reduce the risk of all of those bad things. So by secondary prevention, accept the fact that you will have hearing loss as you get older, but that you can prevent those unintended consequences.
This has been a great discussion, Keith Darrow. Certainly worth everyone's time to check this interview out and learn what he's all about. I want to give you the final word. Is there anything else you wanted to make mention of before I end this interview?
How about this? there's one thing I try to tell people, and I'm trying to spread this word, and it's a little funny. So hopefully it's one of those funny anecdotes that people will remember. This goes for physicians. This goes for the layperson. If you're wondering, when do I have that first hearing test? Because I'm not sure. Is it me, or is it the environment? Is it too noisy? What's going on here? And our simple catchphrase is ears and rears. When you turn 50, in addition to getting that colonoscopy, which is really important, take the time to invest. It's an hour of your life, and you don't need anesthesia. You don't have to go through any prep work like you do for a colonoscopy, but get your ears checked, because it's potentially one of the most important things you can do to have an active, healthy lifestyle as you age.
This has been great. I want to encourage people to visit Keith's website, excellenceinaudiology.org. We'll also include a link to his LinkedIn account, because he is a great person to follow on LinkedIn. And again, our guest today has been Keith Darrow, and it has just been a fantastic discussion. Thank you so much for your time today.